Hello, everyone. So our topic is going to be on pressure ulcers, hospital-acquired pressure ulcers. So our before is going to start with the patient being admitted, and that's going to lead to a 4-eye skin assessment by 2 nurses, followed by a Braden scale assessment. And based on that assessment, whether they have a high score on the Braden scale or a low score, they will develop a plan of care based on their assessment. So if the Braden scale is scored 19 or higher, then no intervention will be necessary. But if it is scored 19 or lower, then an intervention will be needed. So a list of the interventions will include a risk assessment every shift, and every 2 hours, we're going to try and implement turns. And that will be using turning wedges as well as keeping the patient clean and dry. So every 12 hours doing this risk assessment, we're going to check and see if the patient developed a pressure ulcer. And if they didn't, then no further intervention is needed. You would continue with the turns and you would continue monitoring. But if they did, you would assess what stage the ulcer is. You would document the size, depth, location, any signs of infection or necrosis. What you would do next is you would notify relevant members of the healthcare team, including the provider, the oncoming nurse, as well as the charge nurse, and you would also follow hospital protocol to file an incident report, just stating that the patient developed a hospital-acquired pressure ulcer. So the next thing is going to be the wound care team. They're going to be determining the plan of care for this patient, and they will also collaborate with the nurses and nursing assistants for specific interventions that are needed. In that third frame, there's no technology for this aspect, so we're going to move on to after an intervention is implemented. So we're going to start where the patient is admitted, and it's going to go about the same way with the 4-eye skin assessment by the nurses, and the Braden scale, and you would develop a care plan based on your assessment. If the score is 19 or higher, you would have no intervention, but if it is lower than 19, then the intervention will be needed. So we're still going to do that 12-hour risk assessment, always checking to see if the patient developed a pressure ulcer, and if they did, if they didn't, no further intervention would be necessary. You would continue monitoring, and if they did, you would assess the ulcer stage, document, notify any relevant members of the healthcare team, follow hospital protocol, and also notify your wound care team, which would determine a plan of care and also collaborate with the nurses and the nursing assistants for interventions. So the other intervention is going to be the attaching the sensors to the patient, which is going to notify the nurses when it's time for a patient to turn. So the first step in this is preparing the patient's skin to apply the sensor to them. And during the hourly rounding, you're going to check this sensor to check their turn status. So every 2 hours, if it's a flashing light, you're going to turn them, but if there's no flashing light, then there's no turn that's necessary. And if the sensor is not working properly, you would contact IT for help, and they would troubleshoot any issues going on with the sensor and notify the nursing staff. So after attaching the sensor, the technology aspect of this is ensuring the sensor is connected to Wi-Fi. And once attached, the nurse can monitor the sensors from the nurse's station, so they don't necessarily have to go and check the sensors by hand, but they can check it from the nurse's station. So this would just help with that every 2-hour turning, just to make sure it's getting done, as well as checking for if a pressure ulcer did develop every 12 hours. So yeah. So our 3 frames in total is going to be nursing, wound care, and technology. And yeah, that's it, our before and after.